Hello everyone, my name is Archer Pathi,
Hi everybody, my name is Shukla.
and today's topic is OSA, or obstructive sleep apnea. So obviously the first question, what is OSA?
Yeah, as the name says, obstructive sleep apnea is a condition where there is obstruction in the upper airways, noted during sleep phases. Apnea means lack of breathing. So there's no air exchange, no oxygen comes in, no carbon dioxide gets out, leading to low oxygen and stress within the body.
Okay. So what are some of the more common symptoms of OSA?
Many times it goes underdiagnosed or undiagnosed because it can be asymptomatic. If people were to have symptoms, the more common symptoms include morning headache, waking up with a headache, or feeling tired when you wake up, sleepiness during the daytime, fatigue, and then some secondary things that can happen with sleep apnea is high blood pressure and abnormal rhythms like atrial fibrillation. So those are also some of the manifestations. Symptoms-wise, it's really wake, fatigue, morning headache or headache that is not explained otherwise, feeling tired, and feeling too sleepy or having sleep attacks during the day.
Okay. Sounds serious. Is it fatal?
Not directly by itself, but the condition it can lead to can ultimately cause fatality.
Okay.
Like we talked about atrial fibrillation, which can lead to stroke.
Right.
It can also lead to heart failure. So in that way, yes, it can be ultimately secondary or tertiary cause in someone's death.
All right. So who is at a higher risk of developing OSA?
Good question. So it's very commonly seen in individuals who have obesity. So overall general prevalence, which is again underestimated, is around 15% to 18% in general population. However, in individuals with a BMI over 30, the prevalence increases to 80%. So 80% of people with that BMI have obstructive sleep apnea.
Wow. Okay. So what are some potential short-term and long-term consequences of OSA?
Like we discussed, so short-term, individuals who are not having restful sleep, feeling fatigued, can have poor job performance, poor quality of life, headaches, and then can get into accidents. So that is fairly common. So road traffic accidents, poor performance in school or work. So that can happen short term. Long term, when we're not exchanging air, your body is in crisis during that time. It can lead to enlargement of the chambers of the heart, leading to heart failure. Likewise, the wiring of the heart changes with this change in structure of the heart, but it gets bigger, leading to abnormal pathways, causing abnormal electrical activity like atrial fibrillation. When that happens, there can be clots that form in the upper chambers of the heart that can travel to the brain, leading to stroke. And then sleep apnea is an independent risk factor for diabetes and hypertension. So if, let's say, you do not have the genetics for diabetes, but just have the sleep apnea, you can still get diabetes because there's untreated sleep apnea. So that's a big one. Dementia, so in elderly individuals who have higher incidence of sleep apnea anyway, can get early dementia. Premature death is known, and those are really the big ones. Then of course there are other secondary conditions that can be, metabolic conditions that go all together.
Okay. So what are some lifestyle factors that can worsen sleep apnea?
Yeah, so sometimes we see sleep apnea in younger people who are not obese. In those people, it's been studied that medication use, and most commonly the hypnotics, sedative use is associated with sleep apnea. So taking Xanax, Ambien, any sleep agents can put your brain into abnormal sleep cycles, leading to abnormal arousal state and causing sleep apnea. Then alcohol use is another big one. Now, if you're talking about lifestyle, so obesity, in the obese sleep apnea domain, all the lifestyle risk factors that go into obesity also increase the visceral adipose tissue, not only in your abdomen, but also in the upper airway. So the tongue is thicker, these muscles are they're less responsive, relaxes during sleep and closes the air, shuts down the airway. So So any risk factor for obesity is a risk factor for sleep apnea. In addition to that, alcohol is the big one.
Okay, so during sleep apnea, your airway is blocked, but you're still sleeping.
Sometimes you're woken up. So different people have different arousal thresholds. So some people can sleep through that choking episode.
Yeah.
They're getting no oxygen. The oxygen is saturation is dropping, and they're being literally choked, and they will not wake up.
Okay.
And some people do have arousals. Not everybody. Sometimes people have abnormal REM sleep cycles or REM behaviors, and that could be an indicator for sleep apnea.
Okay. What treatment or therapy options are there for OSA?
The mainstay of treatment is CPAP, or continuous positive pressure, where your inspiration, the air that goes in, is higher pressure. So even though this is floppy and blocked, the pressure coming in is enough to open it up.
Oh, okay.
So that's the most direct anatomical correction, and that is really what most people get. Especially for moderate to severe. For milder one, if there are reversible factors like obesity, you would want to treat obesity with medications we have discussed. GLP-1s like semaglutide, tirzepatide are approved for the treatment of sleep apnea now, because we see even the visceral fat from these muscles and the airway is removed. Sometimes sleep apnea will reverse, sometimes not. So the important part is seeing a sleep medicine doctor who can pick the right modality of testing for you.
Right.
They might start with a home sleep apnea test or not, or might directly take you to an in-lab split. So nowadays we don't do the whole night, it could be split. Lab polysomnography testing, and that can be done, especially if somebody has more complex health conditions already, or uses medications like opioid, which suppress the breathing centers of the brain, and the brain is not causing you to breathe. So that's another central sleep apnea. It's a whole different category. But if there is something that can confound your test findings for obstructive sleep apnea, then you would want a better test, which would be a polysomnography test.